What I find most rewarding is connecting with nurses who now understand the risks of exposure and are committed to minimizing their personal exposure. When I first started speaking about safe handling, and there were a lot of nurses who were skeptical about the need for self-protection. I rarely see that now. Nurses are concerned for their own safety and more open to protective behaviors.
You're listening to the ONS podcast, where ONS Voices Talk Cancer, a resource from the Oncology Nursing Society. Through conversations with subject matter experts, we examine the important issues in oncology nursing, from new treatments to patient-centered research to advancements in clinical practice. Join us as we hear from nurses in all facets of oncology care, from bench to bedside and everywhere in between.
Hello, and welcome to the ONS podcast. I'm your host, Liz Rodriguez, member of the ONS 50th Anniversary Committee. Today, I'm really excited to be joined by Martha Polovich. She's an adjunct professor at the University of Maryland School of Medicine, and we're here to talk today about the evolution of safe handling of hazardous drugs and how ONS has supported safe handling policies. This episode is part of a series celebrating the 50th anniversary of ONS. Throughout 2025, we'll feature monthly episodes exploring ONS's rich history and promising future. Thank you so much for joining us today, Marty.
Well, Liz, you're welcome. And thank you for having me on the podcast because I'm always happy to talk about my favorite subject.
Well, this is a real treat for me. I'd like to share with you that I've been an oncology nurse for 25 years. That's exactly half as long as ONS has been around. And when I started, I was a chemotherapy nurse. So I've seen firsthand the significant changes in safe handling in that period of time. Can you start off by telling all of us why is safe handling of hazardous drugs so important?
Well, I started working in oncology in the late 1970s before there were any chemotherapy safe handling guidelines. And that's when the potential risks of occupational exposure to hazardous drugs were first published. An early study found that nurses who administer chemotherapy had mutagenic changes in their urine, and what that meant was that they had absorbed the drugs and were excreting them in their urine. Because many of these drugs are genotoxic and known carcinogens, and many have a negative impact on reproduction, and most have organ toxicity, those are the reasons we need safe handling guidelines. Because hazardous drugs can't tell the difference between cancer cells and normal cells. So for that reason, healthcare workers should not be exposed to these drugs.
Well, that underscores the importance. I'm so interested to hear in the 70s and 80s, what were some of the early methods that nurses used for safe handling?
Well, PPE, as always, been recommended to reduce exposure because gloves and gowns provide a physical barrier to protect against dermal absorption. But what we didn't know back then was what gloves and gowns were made of mattered. So PVC gloves were often used just because they were readily available in all our clinical settings. Gowns were rarely worn for drug administration, even though they had been recommended since early on. And many considered gowns back then as optional because the wording in the OSHA guidelines said recommended and not required. And I recall wearing isolation gowns in my earliest oncology settings.
That is really fascinating to me. I remember that in the late 00s, we first introduced the use of protective gowns in my organization, and we actually faced quite a few challenges. One of them was changing the culture of the nurses. Many found them to be an obstacle. They were hot. It was difficult to ensure compliance amongst the nurses. We also faced budgetary constraints at the organizational level. These gowns cost a lot of money, especially the right ones, as you say. What other kind of challenges can you tell us about that nurses had faced related to the use of safe handling PPE and other precautions?
I would say in my practice, one of the biggest challenges early on was that in the early 1980s, chemotherapy administration started to move from the hospital inpatient setting to outpatient clinics. So there was a shortage of pharmacists back then, believe it or not, but even in hospitals, there weren't that many pharmacists. And so when chemo moved to the outpatient, nurses were often responsible for mixing the drugs as well as administering the drugs, and that included chemotherapy. So most of us who went to nursing school way back then learned how to do that. But our training was for accurate dosing and how to protect the sterility of drugs and IVs. But we weren't taught about hazardous drug exposure because when I went to nursing school, chemotherapy was not commonly administered. Also, biological safety cabinets were rare, so those who mixed chemo did so in medication rooms with no protection against inhalation exposure. So this was also pre-HIV and AIDS, and therefore pre-universal precautions. So we were not used to wearing gloves even when we administered IV drugs or when we emptied bedpans. So all these tasks fell to nurses, and it might be the same nurse who did it all. So this meant multiple opportunities for hazardous drug exposure.
Wow. I have such a great visual when you tell these stories. It's really, as I said in the beginning, amazing how far we've come. A lot of the progress, I think, is supported through regulations. And earlier on, you mentioned that OSHA had come out with recommendations for the use of gowns. Can you tell us a little bit more about how regulations have helped to play a role in supporting organizations to implement safe handling guidelines?
So in the early days, there were no regulations about hazardous drug exposure. A regulation means that compliance can be enforced. Even today, USP has standards, but USP has no ability to enforce them and relies on state boards of pharmacy and accrediting organizations to assess compliance with the standards. So ASHP, or American Society of Health System Pharmacists, published a technical assistance bulletin about safe handling of chemotherapy in 1985. So this dealt with the pharmacist's role in the safe handling of chemotherapy. The focus was reducing exposure during mixing. In 1986, OSHA published the first national guidelines, which were nearly identical, so they borrowed heavily from the ASHP guidelines. But they did include other handling activities such as drug administration and handling of body fluids. Still, at that time, inhalation was thought to be the most significant route of exposure. That's why biological safety cabinets were recommended. Now, ONS came out with its first guidelines in 1988, and they didn't really differ from ASHP and OSHA, but they did emphasize the nursing role in handling and provided practical application of safe handling techniques for nurses. Now, I think the most influential publication came from NIOSH, that's the National Institute for Occupational Safety and Health, and that was in 2004. So ONS appointed me as liaison to that working group that developed the NIOSH alert. Other professional organizations and scientists and agency personnel from OSHA and NIOSH cooperated to state the risks of occupational exposure to hazardous drugs and to harmonize the guidelines to reduce hazardous drug exposure.
So this was really a time where ONS was emerging and commenting and starting to advocate on the behalf of oncology nurses. And we all know that ONS has been widely recognized as an organizational leader and trusted resource for oncology nurses on safe handling. So in what ways has ONS specifically contributed to advocating for the safety of our healthcare professionals and patients as it relates to the safe handling of hazardous drugs, waste, and body fluids?
Well, ONS, and I've been a member of ONS since 1985. As I said, they published the first safe handling guidelines for nurses in 1988 and have updated them periodically since then. So those original safe handling guidelines were one module of the publication that eventually evolved into the chemotherapy guidelines and then the chemobio guidelines and now the chemoimmunotherapy guidelines and recommendations for practice that we have today. ONS also published several editions of Safe Handling of Hazardous Drugs, 3 of which I was editor for. And this book, the Safe Handling book, became the textbooks for the ONS online Safe Handling course. And ONS has been involved in advocacy and in organizing other professional organizations to come together to publish guidelines that were harmonized so that we were all saying the same thing. And that included other oncology professionals, not just nurses.
That's really so powerful and an important point, I think, Marty, and how ONS served as a leader in bringing together the multidisciplinary team members and healthcare professionals that this topic is so important to. We've spoken already a little bit about the evolution of the use of different types of personal protective equipment. You mentioned the use of gloves, the types of gloves, and then into gowns. Can you tell us a little bit about how advances in PPE, what types of impacts they've made on safety? Can you speak a little bit more about that? And in particular, how ONS's position on PPE use has supported those important aspects?
The recommendations for what PPE we should wear when handling hazardous drugs have not really changed substantially over the years. The quality of the PPE, however, has improved. In the 80s, OSHA stated that thicker gloves were better than thinner gloves, no matter what the material the gloves were made of. And back then, latex was thought to be the most protective. But we also know that people have developed latex allergies, so it's not likely to be the best choice. So those early chemo gloves were a bit like wearing gloves you might use to clean your oven. They were so thick and got in the way of taking care of patients or mixing drugs or administering drugs. So the biggest change, I think, is that gloves that are currently available are very thin. And they provide the necessary protection for those who are handling hazardous drugs. We now have a glove standard that requires permeation studies to demonstrate the protective ability of the gloves before they can be labeled for use with hazardous drugs. So any worker can just pick up the box of gloves and they can easily see right on that box if the gloves that they're using are appropriate. There's also a gown standard. It took many, many years for the gown standard to be developed. And the standard does provide protection, but as you said, there are cost implications for using these gowns. And so that's a challenge that we have in practice.
Marty, you mentioned that when you went to nursing school, nurses weren't taught really much, if anything, about how to handle hazardous drugs. And I would say that was certainly true even 20, 25 years later when I was in nursing school. How do you think that training and education for nurses has changed over time? What kind of education do nurses get nowadays, or where can they turn to for a better understanding on how to handle these hazardous agents safely?
Having taught in the School of Nursing, I was teaching in the graduate school, so I didn't have much to do with the undergraduate education, but I was a guest speaker in some undergrad courses, and my topic was hazardous drug exposure, and mine was the only lecture that the undergrad students got on handling hazardous drugs or chemotherapy. I felt bad about that, but then I didn't get any education about it in nursing school. But to be honest, chemotherapy was new when I went to nursing school. So in general, undergrad education or licensure education, there isn't much. It would just be the bare minimum. I think ONS has always advocated for the kind of on-the-job training or postgraduate education so that the organization would provide information about the risks of exposure, about the PPE to use, and the policies that each organization has. And so that would be a part of basic oncology nursing education that I think it's evolved in many organizations. Having been a clinical nurse specialist in several hospitals and clinic settings, I was the one to provide that education. Other people who did my role also did that to make sure that the nurses weren't giving chemotherapy until they'd been properly prepared to do that. And ONS has supported that as well with the chemo course and the safe handling course, and provided information so that orientation to settings where hazardous drugs are present would happen for the nurses in those settings.
Thank you so much. Earlier on, you were talking a little bit about the challenge in establishing what the right type of gown was. I imagine that you're referring to the level of permeability it had and really getting us to a place where we're moving from it being a recommendation to a standard. Can you talk a little bit more about other challenges that we faced in getting some of these best practices into policies and regulations? And if you like, in particular, what is a highlight for you in terms of a success story around these policy changes?
Well, I think there's two success stories that I'd like to share. And one is ONS's efforts in working with the other oncology practitioners to harmonize recommendations. So a few years back, ONS coordinated a group with representatives from AOCN, which is the Pediatric Hematology Oncology Nurses, ASPO, ASHP, which is the pharmacist. HOPA is also the Hematology Oncology Pharmacist Association, and also ACCC, which is an organization that has a lot of cancer centers under them. ONS worked with all these groups to develop some resources for PPE selection. So pharmacists and nurses and administrators got together and did review of the literature and develop some resources for all of our members about how to select PPE. And these resources are still available, along with some others, on the websites of the organizations, including ONS. So if you go to the ONS Learning Library on ONS Online, there's some resources about selecting PPE and making decisions about that. So most recently, ONS HOPA developed a position statement on safe handling of hazardous drugs. So HOPA is the Hematology Oncology Pharmacy Association, and then, of course, ONS members. And we worked together to develop that position statement. And this came because our two organizations were unable to support some of the other proposed guidelines from another organization. So we got together and through our cooperation resulted in language about the importance of safe handling, about supporting safe handling for practitioners, pharmacists, and nurses. Also, I feel really good about this. Our cooperation resulted in language about protecting the rights of staff who are trying to conceive or who are pregnant or who are breastfeeding to engage in alternative duty that doesn't require them to handle hazardous drugs. And also, we had a statement in there about patients and families receiving education about safe handling, because in early days, that didn't happen. I can tell you it did not. But we know the importance of that, and that nurses and pharmacists can work together to provide that education to patients and families as well. So those are important ways that ONS has influenced supporting safe handling, preached it, if you will, to our members. And then the pharmacists also, have been involved in this, and they support that with their professional association members as well.
Marty, thanks so much for mentioning the patients and families. You started out by noting that so much of chemotherapy administration occurred in the inpatient setting early on. We saw that then shift to the outpatient setting. And now, many of us are seeing care shifting into the home. So much of our oral agents are self-administered by patients at home, and then even looking to provide injectable and infusion therapies into the home. So I appreciate you noting the importance and the role that oncology nurses play in educating our patients and families, likewise in safe handling of these drugs. It also makes me think about disposal. That is something that I've observed evolve in my career, how we're disposing of the hazardous waste. And I was just wondering if you can share with us a little bit about how you've seen that change over the years.
I think the environmental concerns have received more attention in the last 10 years than ever. Now, having been a nurse for over 50 years, I think back to the early case, and we really just had like isolation waste and all the rest was regular waste. That doesn't happen anymore. Organizations that generate this waste have contracts with disposal companies. And we have all the different colored bins in some organizations for what trash goes where. And of course, implementing those kinds of practices are challenging for the people in the front lines. However, the drugs are being disposed of safely so that there's less environmental impact from all of them. So to be honest, the EPA rules about how these hazardous drugs are disposed of haven't changed since the 70s. So as long as, I've been a nurse, that hasn't changed. But states sometimes are very strict about what goes where. And so I think that's progress for the environment and also for potential exposure of workers in healthcare settings.
Right now, as we're thinking about the future and so much of care delivery is influenced by technology, what types of advances might stand out to you from a technological perspective? And what do you think lies ahead for us in terms of innovation in safe handling of hazardous agents?
Well, I don't have a crystal ball. I hope that in the future, the safety of the healthcare workers, such as nurses and pharmacists, nursing assistants, and all those involved in the care, that their safety will be as important as patient safety. Patient safety has been a push for many years, and everyone refers to patient safety as all important. But if there's no worker safety, then who's going to take care of the patients? I hope that PPE is the highest quality, that there are technology like closed system transfer devices or CSTDs. This, I think, is one of the innovations that's, believe it or not, it's been around for, 20 years almost. But I hope that this will be considered the norm in protecting healthcare worker safety. Of course, many of them could stand with some improvement in their ease of use because it's an add-on piece of equipment that doesn't always happen. But I think that that is one method of protecting worker safety because let's be honest, IV equipment that we have is the same now pretty much. Tubings, IV bags, maybe we have bags instead of bottles like when I was a new grad, but the tubing hasn't changed much. We did some innovation in IV catheters for safety, but that was to prevent needle sticks. But other than that, things are pretty much the same. So I hope that the emphasis will be no leaking instead of just keep the fluid sterile. We don't want leaks, and that's what the CSTDs help prevent, because that's one of the biggest sources of exposure for nurses in handling hazardous drugs.
Well, I would just want to really thank you for your leadership in this space on behalf of oncology nurses and oncology health professionals. It really has been a privilege to talk with you today about the evolution of these safe handling practices since the 1970s. Marty, to close us out, what would you say is the most rewarding aspect of your work over the decades in this very important space?
What I find most rewarding is connecting with nurses who now understand the risks of exposure and are committed to minimizing their personal exposure. When I first started speaking about safe handling, and it's going back a long way, there were a lot of nurses who were skeptical about the need for self-protection. They had been handling hazardous drugs for years and had no signs of ill effects. And so they assumed that we were overreacting with all the recommendations. They saw the use of precautions and PPE as a speed bump in their busy day and also thought that was unnecessary. I rarely see that now. Nurses are concerned for their own safety and more open to protective behaviors. So to me, that's not an evolution. It's not a revolution, but it is an evolution toward self-protection. Whatever the reason for that, I'm grateful to see that organizations also are concerned about the safety of their employees. So maybe not everyone's on board, but we're moving in that direction. And that's what gives me the most joy because of the early days when people were exposed without even knowing that it could be harmful for them. I would like to add that I'm working on a project. We've developed a registry for hazardous drug handlers, nurses, pharmacists, veterinarians, vet techs, anybody who handles chemotherapy. And we've just begun to collect data, and we're going to provide feedback then to people who join the registry about the adverse health outcomes. Of course, we're not looking for adverse health outcomes to happen, but if they're there, it's important to document that so that workers can, be convinced to use their protective behaviors in the future. This project has been supported by ONS and several other organizations. And so it was on my bucket list always to have a registry for hazardous drug handlers, and it's happening.
Wow, that's amazing. And I think truly a testament to leaders like you and the consistency of the messaging over time. As I said, I saw that myself when we first introduced gowns and, the hesitancy and sometimes resistance to believing that there was a true risk. So I do thank you for your commitment and consistency in messaging. If folks wanted to learn more about the registry, Marty, what would they do?
ONS will be publishing information about how to be involved in the registry. Our website is not quite ready for public consumption yet, but we'll have links to the website and links to the survey for people who are eligible to be involved in the registry.
Thank you again, Marty. I appreciate so much the time that you've spent with us today. And also, as I've said, your leadership. Looking forward to the future and what information and knowledge we'll gain from things like the registry and our experiences in safe handling of hazardous drugs going forward.
And it's been my pleasure. Thank you.
Thank you for listening to the ONS podcast. Tell us about your favorite part in this episode by leaving a review wherever you download your podcast. For more resources and information about oncology nursing, visit us at ons.org and ons.org/voice. The ideas and opinions shared in this episode represent those of the guest and not necessarily ONS.